this summer's rotations were ones that I was really looking forward to, actually. The dentist and the eye doctor, I was kind of worried about them being monotonous, just with the patients they see and what they're doing day to day. I was kind of right about the eye doctor and then kind of wrong about the dentist. Overall, it was a really great summer of rotations. I learned a lot, and a lot that I am looking forward to take with me through the rest of my career. Starting with Dr. Nate for just individual reflections. Midwest Eye Consultants was a really great place. Everybody there was extremely nice. Dr. Nate himself, I said hi to, and that was pretty much it. I followed one of his techs around the whole afternoon, just because she kind of does the more like the actual checkup part of the exam, the kind of the dirty work. So that was the most to see, which I understand. And she was willing to answer all my questions, and she was really nice. And I mean, I've gone to the eye doctor my whole life, and there were still some like diagnostic tools that I didn't actually know what they did, and so she was able to teach me that and teach me new things that I didn't even know, and see some tests that I didn't know they did. I only sat in the room with Dr. Nate for one patient, and it kind of felt like he just wanted to get in, get out, and move on to the next one, get his day over with. And I know he travels a lot to other locations, so maybe that's why. But I think future students going to these rotations, they should follow him for at least half the time that they're there, because they would definitely miss a lot if they didn't follow the tech. But I think seeing the doctor with the patients is extremely important as well. At the chiropractor with Dr. Joel, he is an extremely busy guy. He takes a patient back, does his stuff on them, walks them back out, and while he's out there, he grabs the next patient and brings them back. So with him, there wasn't a lot of time to ask any questions. It was the rare time when a patient was running a little late or right before we breaked for lunch. I was able to ask him, some of the questions that had been building up. His patient interaction is pretty great, especially with the patients that he's had for a long time. They're like old friends of his. He can joke with them, he can be sassy and sarcastic with them, and they don't care. Everybody who comes to him seems to thoroughly enjoy having him as their chiropractor, and it's not just something that they dread coming to do. He does some pretty cool stuff besides just cracking backs and cracking necks. I got to observe him adjust several ribs back into place, and it was kind of crazy that people would come in saying it hurts when I take deep breaths, and he could feel them and be like, yeah, your rib is out of place, and he let me feel a couple and try and notice the difference, which is subtle. But he would adjust their ribs, and then he'd ask them to take a deep breath, and they would be pain-free. So that was really awesome. He adjusted an 8-week-old baby, which I didn't know you could do. I didn't know it was safe to do, but he assured me it was, and he's done it multiple times, and the baby always cries because they don't expect it. But that was pretty insane to see. A patient let me sit in while they looked at her MRI of her cervical spine. She had a herniated disc at C5 and C6. So much so that it was touching her spinal cord and causing numbness and tingling down her arm and just really bad pain. And he helped me. He showed me exercises that she could do between appointments with him to help her condition improve, and watching him work with her, which was so different from any other patient I had seen him with. It was cool how he can kind of switch gears from being joking to, okay, get down to business, and we're gonna get this better for you. His whole demeanor is pretty awesome, especially for new patients who, like me, who think the chiropractor is terrifying. I'm warming up to it, and I consider going now because of him. At the Walnut Clinic with Dr. Struble, this is the rotation that I think I was most looking forward to, because I knew as a general physician she was going to see a wide range of patients with a wide range of conditions, doing something different with each one every day. Her patient interaction is fantastic. She got a minor in psychology because that's what she thought she was going to do before deciding on med school. So you can really see that education coming through and how important it is to have that knowledge, because a lot of patients, a lot of them that she saw were coming in with kind of unnerving things, and with that background in psychology, she was able to kind of say the right things and bring them back to a place where they could trust her and trust the process and trust that medication isn't always going to work right away. You have to find the right balance, and we're going to do that for you. Every patient was her friend, and she took her time with each one, even if it meant she fell behind on her schedule. And she was good at multitasking, and truly multitasking. Patient could be talking about, like, they're not sleeping well at night, or they find that their appetite isn't what it used to be. They could be saying that while she's looking up their medication list. Some of the things that she did that we have talked about and learned in class, I got to listen to wheezing and crackles in 2 different patients' lungs. It's definitely different hearing it in real life than it is from a recording, so that is a golden piece of knowledge that I can take on with me for the rest of my career. She did lower quarter screens, and I got to see x-rays of cervical spine and hips with arthritis, and then seeing a patient who actual symptoms of a fractured rib, and then going with the x-ray tech and seeing his x-rays, and that was cool to see. And the x-ray tech there was really awesome and willing to let me come back with her, and she pointed things out when she saw them and taught me just a little bit about being an x-ray tech, and I think that one was my favorite overall. Dr. Myers, again, his patient interaction, fantastic. Every person that comes in is like his long lost best friend. He sits and talks with them anywhere from a minute to 15 minutes, it seems. Even if it means his schedule falls behind a little bit, you can see that having his patients feel comfortable and feel relaxed is his number one goal. He wants everybody to walk out there smiling. I got to learn that osteoporosis can cause tooth sensitivity. Fillings are a common procedure that he does, but he approaches each one differently, and he takes into concerns the wants and the needs of the patient instead of just, well, this is what I learned to do, so this is how we're going to do it. Is something that I think all of us need to learn how to do. Just because we learned it this way doesn't mean we have to do it that way, especially if it makes the patient uncomfortable with it or uncomfortable with us. And one of the cool things that I got to do hands-on was monitor a patient's blood pressure, heart rate, and pulse ox during a procedure, because she was getting nitrous oxide gas. So I got to monitor that while he was doing the procedure. So overall, this summer was a really good experience with a lot of things that I learned that I can take with me, you know, into our fall rotation and into the rest of our life. These are definitely locations that, as athletic training students, we should see and we should learn about and we should be comfortable with, because these are professions that we will be working closely with. So having that experience now with them was a huge positive.